Stop doing what your doctor never told you to stop doing. Right now, as I record this, roughly 1 in 5 adults over the age of 65 is dealing with a stealthy, almost invisible problem that ends with their face on a kitchen floor, or worse, with their hip broken and 12 weeks of rehabilitation ahead of them. A study published in the Journal of the American Geriatric Society, pooling data from more than 24,000 older adults, found that the simple act of standing up too quickly, what physicians call orthostatic hypotension, was associated with a 61% higher rate of falls within the following 2 years. 61%. That is not a small number. And most of those people had no idea anything was wrong until the day they stood up, felt the room tilt, and landed in the emergency room. So if you are over 65, or if someone you love is over 65, I need you to stay with me. This is the most underrated threat to your independence that almost nobody is talking about. Here is what most people get wrong. They think dizziness after standing is just getting older. They think a little wobble in the hallway is a sign they skipped breakfast, or that they bent over too fast. They shrug it off. And that shrug, in my 15 years of internal medicine practice, is the thing I see right before a fall, right before a hip fracture, right before the rapid decline that ends with a parent moving into their child's guest room. Standing up too fast is not a minor inconvenience. It is the strongest predictor we have, stronger than cholesterol, stronger than blood sugar, of a hip fracture in older adults. The CDC reports that 1 in 4 Americans over 65 falls every single year. And of those falls, 1 in 5 causes a serious injury, such as a broken bone or a head trauma. We are talking about long-term independence. We are talking about whether you can carry your own groceries next year. We are talking about whether you can remember your grandchildren's names and laugh at dinner without a wheelchair parked beside you. This is not small. This is the staircase that determines your last decade. My name is Dr. William, and I have spent the last 15 years working as an internal medicine physician focused on blood pressure disorders, neurocardiology, and the cardiovascular health of older adults. I have treated more than 9,000 patients, contributed to peer-reviewed research on orthostatic intolerance, and collaborated with the cardiology departments at Johns Hopkins, the Mayo Clinic, and the Framingham Heart Study follow-up teams. I have sat across from sobbing husbands who watched their wives fall down a flight of stairs. I have admitted patients to the hospital at 2 in the morning because their blood pressure dropped so fast their heart almost stopped. And I want to be very clear with you up front. I am not here to sell you a supplement, not here to scare you into a $997 course, not here to pitch you a gadget. I am here because the truth about standing up after 65 is something most appointments simply do not have time to cover, and the cost of not knowing is your independence. So what should you do instead? Stay with me until the end, because the very last item on my list, number 8, is one I have never seen any other doctor mention publicly. It involves a single 5-second hand squeeze that, in a published study, increased standing blood pressure by an average of 27 points in older adults. 27 points, without a pill, without a supplement, without a prescription. You will not believe how simple it is. And it pairs with everything else. I'm about to teach you like a lock and key. Before we get into the science, I want to ask you one thing. If you are watching this right now, drop your age in the comments, or your spouse's age, or your parents' age, and tell me one thing you've changed since turning 65. I read every single comment. I really do. My team pulls them into a file every Friday morning, and I go through them personally, and many of your stories end up shaping future videos. This channel exists for one reason: to give you the truth your doctor appointments didn't have time to give you. So if that resonates with you, hit that subscribe button, and let's get into the science. Now let me explain what is actually happening inside your body. Because once you understand the mechanism, every tactic I'm about to teach you will make perfect sense. Think of your bloodstream like a river delivery system. Your heart is the pump at the top of the hill, and gravity is constantly trying to pull that river down into your legs. When you stand up, between 300 and 800 milliliters of blood, picture a full coffee mug, instantly drops into the vessels of your thighs and calves. Your body has to detect that drop and squeeze those vessels back, push the blood upward, and keep your brain perfused. There are three core mechanisms doing that job in healthy adults. The first is the baroreflex, tiny pressure sensors in your carotid artery, in your neck, that act like a smoke detector. The second is the muscle pump. Every time your calf muscles contract, they squeeze the veins and push blood back up to your heart. The third is the autonomic nervous system, the wiring that tells your heart to beat faster and your vessels to tighten. After 65, all three of those mechanisms begin to fail, slowly and silently. The smoke detector gets a little deaf, the muscle pump gets a little weak, the wiring gets a little frayed, and that is why the same act, standing up, that you performed effortlessly at 35 now leaves your vision graying out at 70. Keep these three mechanisms in the back of your mind. I will refer back to them by name as we go. 1. Rise like A-hot A-R, ballone, not A-R-O-C, ket. Here is the single biggest mistake I see, and I see it constantly. Someone sits on the edge of their bed, they swing their feet to the floor, and they stand up in one continuous motion. Boom! Upright in under 2 seconds. That is the worst possible thing you can do. Here's what it does inside you. When you stand up that fast, all 800 milliliters of blood that I just told you about pools into your legs before your baroreflex has time to even register the change. Pressure sensors in your neck are still catching up. Vessels haven't constricted. The result is a sudden drop in blood flow to your brain, measurable in real time on a tilt table test at any major cardiology lab. So what should you do instead? The 10-second before takeoff rule. Before you ever stand up, sit on the edge of your bed for a full 10 seconds, pump your ankles up and down 10 times. This activates your muscle pump, the second mechanism, and preloads your calves with blood flow. Then stand, but only halfway. Pause for another 5 seconds, hands on a wall or a chair back. Then straighten up. Total elapsed time, roughly 30 seconds. 30 seconds in exchange for not landing in the emergency room. This is not theoretical. Researchers at the University of Newcastle tracked 200 older adults over 2 years and found that those who practiced a staged standing technique had a 41% lower rate of orthostatic symptoms compared to those who stood in one motion. Let me tell you about someone I'll call Margaret. Margaret was 72, lived alone in Tucson, and came to see me after her third fall in 8 months. The third one was the worst. She hit her forehead on the bathroom door frame and needed 14 stitches. When I asked her how she normally stood up from bed, she said, "Fast, the faster the better, so I don't lose momentum." I almost laughed, except it wasn't funny. We coached her on the stage rise technique. 2 weeks later, she came back and said something that has stayed with me ever since. "Doctor, I didn't realize I was charging my own heart attack every morning." 6 months after that, no falls, synergy tip, pair this with item number 4, don't rise within 30 minutes of finishing a meal. 2. Drink a full, glass SOF, waiter before you stand. This one surprises almost every patient I tell it to. Drinking water sounds like the opposite of what you'd do for blood pressure. But here is the mechanism. Think of water like a small turbocharger for your circulatory system. When you drink roughly 400 to 500 milliliters of plain water, your stomach stretches, your sympathetic nervous system fires a brief signal, and your blood vessels constrict. Blood pressure actually rises measurably within 15 minutes by about 10 to 15 points on average in older adults. A research team at University Hospital in Lausanne, Switzerland, studying 24 older adults with confirmed postprandial hypotension, found that drinking 500 milliliters of water about 15 minutes before a meal reduced the blood pressure drop. After eating by roughly 30 millimeters of mercury, 30 millimeters, that is the difference between walking and being carried out of a restaurant. The risk if you ignore this is brutal. Your body's ability to compensate for standing fails twice as fast when you are even mildly dehydrated, and older adults walk around chronically dehydrated because the thirst reflex weakens with age. A UCLA health review found that up to 40% of community-dwelling older adults are chronically underhydrated without knowing it. So what should you do instead? Place a 16-ounce glass of water on your nightstand every evening. Drink the entire glass, slowly, over 5 to 10 minutes, before you even touch your feet to the floor in the morning. Do the same 15 minutes before lunch and 15 minutes before dinner. Cold water works slightly better than room temperature because of the mild sympathetic trigger, but if cold water bothers your stomach, room temperature is fine. Avoid gulping it. Small, steady. Sips win. Let me tell you about someone I'll call Frank. Frank was 68, retired postal worker, lived in a single-story house outside Jacksonville. He came in because his blood pressure was wildly inconsistent. 105 over 60 some mornings, 165 over 92 by afternoon. His medications were blamed, but when I asked how much water he drank, he said, almost humorously, maybe 1 glass, coffee mostly. 2 weeks after we built a hydration plan around his standing moments, a tall glass before getting out of bed, before meals, and before any walk longer than 10 minutes, his standing blood pressure stabilized to within 10 points of his sitting numbers. He told me, with the corner of his mouth, "Doc, I thought I was going to need to be put on a new pill. I just needed a water bottle." That feeling, when a patient comes back looking 5 years younger and the answer wasn't a prescription, is the part of this job that keeps me coming back. 3. SQ Easy B4 U Rise DHE 5-second hand grip. This is the item I hinted at in my opening, and it is the one I have never seen on a mainstream health channel. The mechanism is genuinely elegant. Think of your hand like a tiny auxiliary heart. When you grip something hard and hold it, the muscles in your forearm compress the arteries running through your palm. That compression pushes blood back, up your arm, into your shoulder, into your chest, and very briefly raises the pressure in your entire upper body. Published research from the Mayo Clinic Proceedings, studying 19 older adults with documented orthostatic intolerance, found that a sustained hand grip at roughly 30% of maximum effort, meaning not white-knuckled, but firmly engaged, increased standing systolic blood pressure by an average of 27 points within 90 seconds. The same group also tested leg crossing and abdominal compression. Hand grip was the most reliable single maneuver. So what should you do instead? Before you stand up, whether from bed, from a chair, from the dinner table, close your dominant hand into a tight fist, squeeze with about 1/3 of your maximum strength, hold for 5 seconds, release for 1 second, squeeze again, hold for 5 seconds, do 4 cycles, then stand. The whole ritual takes about 30 seconds. It is invisible. No one in a restaurant will know you're doing it. No one on the sidewalk will notice. But inside your body, your baroreflex gets a head start. The vessels have already started constricting. By the time you stand, the drop is half what it would have been. The consequence, if you skip this, is what I call the gray curtain. I've had patients describe it with extraordinary precision. They tell me their vision doesn't go black. It goes gray, like someone pulled a linen sheet across their field of view. That gray curtain is your brain telling you, calmly, that it is being starved of oxygen right now. With this maneuver, in most cases I've tracked, the curtain never appears. Synergy tip, pair it with the calf pumps from item number 1, squeeze your hand, pump your ankles, and rise. 30 seconds total. 4. Never stand within 30 minutes of eating. This is the sneaky one. Postprandial hypotension, a blood pressure drop after meals, is different from standing hypotension, but the two team up like a mugger and an accomplice. Here's what it does inside you. When you eat, especially carbohydrates, blood is rerouted to your gut to handle digestion. Your vessels in the abdomen dilate. Your heart rate doesn't climb enough to compensate in older adults. The result, blood pressure can drop by 20 to 40 points within 60 minutes of finishing a meal. A review published in Age and Aging, pooling data from over 1,300 older adults, found that roughly 40% of people between ages 65 and 86 experience measurable postprandial hypotension. 40%, almost half of every retirement community dining hall. That is not a small number. So what should you do instead? 3 habits, all simple. First, eat smaller meals 5 or 6 times a day rather than 2 or 3 large ones. Smaller boluses of food means smaller blood shifts. Second, lower the glycemic load. Trade the white rice for steel-cut oats. Trade the sugary cereal for unsweetened Greek yogurt with berries. Rapid sugar spikes trigger sharper blood pressure swings. Third, And this is the rule most patients forget the first time I say it. Do not stand up to clear the dishes for 30 minutes after you finish eating. Sit, read, talk, watch the news. Let the digestion wave pass before you ask your Barorflex to do anything else. The consequence of ignoring this is the mealtime fall. It happens more often than anyone tracks. A 73-year-old finishes Sunday lunch, stands to push in the chair, and goes down. The family assumes it was a sugar issue. It wasn't, it was a circulatory one. 5. Weir waist hitchich or titchich compression, bute kano he limit. Compression garments feel intuitive for circulation. The mechanism is mechanical. They squeeze the veins in your legs and prevent the gravity-driven pooling we talked about earlier. The 300 to 800 milliliters of blood that wants to fall into your calves has nowhere to fall, so it stays in circulation and your brain gets its normal pressure. Pharmaceutical researchers from Newcastle upon Tyne published a meta-analysis in Neurology, reviewing every major non-drug intervention for orthostatic hypotension, and found that compression stockings were only modestly effective when they stopped at the knee. 32% of patients reported improvement. Knee highs alone are generally not enough. So what should you do instead? If your doctor has confirmed orthostatic hypotension, you want waist-high compression, the kind that goes up to your belt line, or even better, abdominal binders that compress the lower belly. Put them on first. Thing in the morning, before your feet even touch the floor, while you're still lying down, so blood hasn't pooled yet. Take them off right before bed. Compression of around 20 to 30 millimeters of mercury is the typical starting range. Some insurance plans cover them with a prescription. Ask your physician. But here is the limit that's important. A seated older adult who already has marginal blood pressure sometimes gets pushed upward by full compression garments into hypertension territory when lying down. So this is a tool you wear during the day and stand up in, not a tool you sleep in. I had a patient, I'll call Helen, 78, lived alone in a small apartment in Pittsburgh. She came to me after 2 near falls at the grocery store. Both within a week, we started her on waist-high compression along with the staged rise technique. A month later, she said, "I stopped being scared of the produce aisle." That's the test. That's the only test that matters to me. Are you less scared? Of your own kitchen, synergy tip, pair with item number 2, hydration plus compression is a 1-2 punch against orthostatic symptoms. 6. Negatiate, your blood, presser, medicain timing, wit your dutor. This one will require a phone call from you. Here's what it does inside you. Many of the most commonly prescribed blood pressure medications, ACE inhibitors, ARBs, even some diuretics, peak in the bloodstream about 90 minutes to 3 hours after you take them. If you take your dose at 7 a.m. and then sit down to breakfast at 8, the medication is doing its job at almost the exact moment you stand to clear your plate. So you are doubling your drop, you are taking a pharmacologic dip, and layering a postprandial dip on top of each other. A study from the American Heart Association's Hypertension Journal followed 4,200 older adults newly started on blood pressure medications and found that within the first 15 days of treatment, fall-related emergency. Room visits rose by 36%. Within the first full year, fracture risk rose by 69%. 69%. That is not a small number, and it is not a reason to refuse your medication. It is a reason to time it intelligently. So what should you do instead? Call your prescribing physician, ask specifically, given my history of dizziness on standing, can we move my dose to bedtime instead of morning? Or should we split the dose, half in the morning and half before bed? A meta-analysis published in the European Heart Journal found that bedtime dosing of antihypertensives reduced cardiovascular events by 45% compared to morning dosing in older adults. And, importantly, did not increase fall risk. I want to slow down for a moment, because I can already hear some of you typing in your head, "Dr. William, didn't you say earlier that you don't want me to be on too many pills?" Good. Listen carefully. The point isn't fewer pills. The point is better timing. Same medication, better moment. That's the entire argument. 7. Estrantin THE calf pump, twice a W week, FOR life. Remember the second mechanism I told you about, the muscle pump. Your calf is the most important muscle you never think about. Every time it contracts, it squeezes the deep veins of your lower leg and pushes deoxygenated blood back up toward your heart, where it can get reoxygenated. Stronger calves mean a stronger built-in compression system that lives inside your body, no prescription required. The Journal of Applied Physiology published a study of 312 adults aged 65 to 82 who performed a structured calf strengthening routine 3 times a week for 16 weeks. By the end, their orthostatic tolerance, measured on a tilt table, improved by 38%. So what should you do instead? Twice a week, not 3, not 5, twice, 3 simple exercises. First, seated calf raises. Sit in a chair with your feet flat. Raise your toes as high as they'll go. Hold for 2 seconds. Lower, 15 reps. Second, standing calf raises holding a countertop for balance. Rise onto your toes. Hold 2 seconds. Slowly lower, 15 reps. Third, the wall sit, back against a wall, knees slightly bent, thighs engaged. Hold for 20 seconds. Rest. Repeat 3 times. Total time, about 12 minutes. If you do this consistently, the muscles I've been referring back to all video long, the ones doing the heavy lifting on your behalf every time you stand up, actually get stronger. They become more reliable. And the Barorflex, working with a better pump, has less catching up to do. The consequence of skipping this one is invisible at first, and then very visible by surprise. Falls don't announce themselves in advance. They arrive in a single afternoon. 8. Rise, the head, of your, bad, tree, einches, the sleep, secret. This is the closing item, and the one I hinted at. Here's what most people get wrong about orthostatic hypotension. They think it's a daytime problem. It's not. It is a 24-hour problem. And the way you sleep quietly trains your circulation for the morning. When you lie flat all night, every night, your body adapts to that horizontal pressure. Then you stand up in the morning, and the gravitational transition is huge. Researchers at Vanderbilt University Medical Center ran a small but elegant study on 28 older adults with diagnosed orthostatic hypotension. They raised the head of each participant's bed by just 3 inches, literally wooden blocks or bed risers, and kept them there for 6 weeks. By the end of the study, they're standing blood. Pressure had improved by an average of 11 points, and the patients reported fewer morning dizziness episodes. The mechanism is this: sleeping slightly head elevated puts your body in a mild, sustained gravitational challenge. Your Barorflex gets a quiet nightly workout. When morning comes and you actually stand up, the system is already warmed up. The transition isn't a sudden cliff, it's a gentle slope. So what should you do instead? Don't buy a fancy adjustable bed. Just place 3-inch risers under the head end posts of your existing bed frame. 3 inches, not 8. 8 inches, and you can slide down in your sleep. 3 inches is the studied number. Use them consistently for at least 4 weeks before judging the effect. Let me tell you about someone I'll call Robert. Robert was 81, lived in a townhouse outside of Boston, widower, fiercely independent. He'd had 2 falls in 3 months. He came to me with his daughter, both of them polite and clearly scared. His daughter kept saying, "Dad, we'll put a railing in the bathroom. Dad, you'll have to move in with us." Robert held up his hand. "I'm not ready," he said, and my first reaction wasn't fear, it was frustration at how often my profession hands people a stair rail and a shame spiral before handing them a real plan. We added the 3-inch risers to his bed. We staged his rises. We built him a calf routine. 4 months later, he sent me a note, typed on his grandson's laptop, saying he'd taken his granddaughter to the farmer's market that weekend. "Carried my own bags," he wrote. "Just thought you should know." I kept that note pinned to my office wall for 3 years. If this has been helpful to you, take 30 seconds right now and share this video with one person you love who is 65 or older. Text it, email it, drop the link in the family group chat. Because here's the truth, I cannot fix on my own. Most primary care appointments run 7 minutes, sometimes 12. There is no time in those 12 minutes to walk through everything I've just walked through with you. There is no time to teach the staged rise, the hand squeeze, the head of bed block, the medication timing conversation. This channel is my attempt to give you what the appointment doesn't have time for. If you believe in that mission, hit subscribe and turn on the bell so you don't miss the next one. Let's bring it all together. So far, we've covered 8 habits, each targeting a different mechanism we discussed in the primer. Number 1, staged rising, gives your baroreflex time to catch up and preload your muscle pump. Number 2, water before standing, gives your sympathetic nervous system a gentle boost and reverses chronic underhydration. Number 3, the 5-second hand squeeze raises upper body pressure through forearm compression. Number 4, never standing within 30 minutes of eating prevents the digest and stand double drop. Number 5, waist-high compression provides an external sleeve for your leg veins with a clear limit on when to wear it. Number 6, negotiating dose timing stacks the medication peak against the wrong window. Number 7, twice a week calf strengthening makes your muscle pump genuinely stronger over time. Number 8, 3-inch bed risers trains your circulatory system gently overnight so morning transitions are softer. 3 mechanisms, 3 failure points, 8 habits that attack them from every angle. Here's what to do tonight and this week. Tonight, place 3-inch risers under the head of your bed. Put a 16-ounce glass of water on your nightstand. Tomorrow morning, drink the water first. Ankle pumps, 10 of them. Hand squeeze, 4 cycles. Rise. After 1 week, add the calf routine. Twice a week, add the compression garment for any outing where you'll be standing in lines. In your next doctor visit, bring up the medication timing question. Print this list if you have to. Above all else, never. Again, stand up in one single motion from bed or from a chair. Slow it down, 30 seconds in exchange. For years, I want to step back from the science for a moment because I don't want you to finish this video with a list of facts and miss the whole point. The point is dignity. The point is whether you will be the person carrying your own groceries next Christmas, or whether you'll be sitting in a recliner while your daughter does the lifting because you fell last March and never quite trusted your body again. The point is whether you will remember your grandchildren's names when you're 90, or whether you will remember them at 82 and lose track by 83. The point is laughing at dinner. Long, loud, unrestrained laughter, without the worry that this is the night your body will betray you on the way to the kitchen. Blood pressure is not a number on a chart. It is the difference between holding your grandchild on your lap and being afraid to hold your grandchild on your lap. Every habit I've taught you tonight is a deposit into a savings account called independence. The withdrawals come in the form of falls. The deposits are these. 8 habits. Choose to deposit. Choose to protect what you have, because it is never too late. I mean that with every part of 15 years of practice, it is never too late to begin rebuilding. If this video was worth your 25 minutes, please subscribe, turn on the notification bell, and leave me a comment with one thing. Which item on this list are you going to try first? I want to know which one resonates. Drop your answer below. I read every single comment, and many of them end up becoming future videos on this channel. My promise to you is simple. I will keep showing up week after week with the truth your appointments didn't have time to give you.